So I like to work from top till down. So I first get the feeling how much I can lift the mid face, and then I move to the vertical vectors. So we remember we have the first opening for the medial jaw, the second one for the lateral jawline, then the third for the nasolabial fold, the fourth for the marionette line, and the last one for the neck. Okay, so I start with the third. Here's the opening. I stretch a little bit the skin in order to enter easier, and then it is very important. Do you want to come around maybe? So here's also one important thing to notice, that I have the suture a little bit more proximally than the tip of the cannula. So we have to pass over this marked point.
Reach this one.
Exactly.
And neck muscle is also weak.
So I open the skin a little bit, I stretch the skin. We have to go until the fascia. So here I notice that I'm with the tip of the cannula in the fascia. It's very important because it's quite, as you can see, it's quite thick. We have to place it deep enough, otherwise we will have visible bumps. So then, by pressing it a little bit down and twisting a little bit, I switch the direction. And here this bump is giving me the right indicator that I'm in the subcutaneous tissue, okay? So not start too superficially directly, because everything else what comes afterwards will be too difficult. That's why I do the opening also a little bit perpendicular already. Then I pinch the skin, and only the skin. I don't, not too much, because like this I would place it too deep. So it's only the skin to create like kind of a tunnel. And then, as I said, I lift the cannula here quite a lot to place it deep enough. Then we know that we always have a ligament here, the zygomatic ligament, which has to be crossed through. And I like to work in this way of going a little bit left and right, twisting a little bit rather than pushing everything forward, because like this I always find the lowest resistance plane, okay? And with this movement, this is also very important, this movement to be done, because like this, I would see when I attached on the superficies of the skin, and I could correct it. If I want to correct something, I have to fix here. I have to fix the suture here, otherwise there will be lost this contact between the suture, okay? So always go forward. Pinching. So I always check where I'm at with the tip of my cannula. And then here sometimes the pinching is a little bit difficult, so I press down the tip of the cannula and I move this tissue a little bit into my direction. Okay, now I'm with the tip of the cannula here. Okay, so I'm in the right depth, in the right point. Now I press down at the tip of the cannula to withdraw and displace this loop, as you remember from the presentation. And I withdraw, and I use all of my hand to already integrate the barbs inside the tissue. Afterwards, I improve even the integration by pressing down with the right hand here. Like this, I maintain the uplifted state, and in this lifted position, I integrate the barbs inside. So the patient notices with this little click, click, click. Sometimes you can even hear it. So now, the next point is very crucial. Like I said, if I would just place now the remaining suture inside, I would just have a floating suture somewhere placed inside the skin. So now we have to do the actual lifting. So I lift my hand here. Surgeons will know this because we work from the fingertips. It's very fine work. So I have to relax my hand. I only do the movement out of the tips of my finger, and I check and I lift, so I see how much I can lift the tissue. And I also have a good control that I see that there's no dimpling. Okay? And now under this lifting of the suture, I fixate the skin and the tissue inside at the proximal point of opening. Okay? So now everything is being uplifted and it stays there. Okay, this part is very important. If we don't do this, there is no sense of lifting. Here you can see the mesh structure a little bit. You can see it's very fine. I was just a month ago in Korea to saw the factory, and I saw how they did it. It's quite impressive. So this is very thin. It's a 7 USB size, if I'm not missing. So we do the reinsertion just a couple of millimeters, and then we check how much we have of the remaining sutures. In smaller faces, sometimes, especially that the distance of the nasolabial fold is quite small, we have too much of the remaining suture. So if we would reimplant it, we get a little bit too close to the mouth. So we can reinsert here as much as we want. It's always recommendable to have a long fixation vector. The second is not for lifting, it's for fixation, to have it as long as possible, to also cover all of the zone with scaffolding. So not because of out of laziness to place it more inside, to have it as long as possible and to place it in 30 degrees. Okay, and then there's another trick. This V shape which we have here at the entry point has to be deep enough. Okay, so it's very important now to place it in the deep layer. We can help ourselves by lifting with the left hand the suture like this. We lift the skin out of the deeper tissue. We re-enter with the cannula and I go perpendicular and I lift one and I press the other one. Okay, and then with a slight pressure I change the direction. I see again my little bump, which is giving me the right indicator that I'm in the right depth. I move forward, just a little bit twisting movements. We always have the ligament there. I see where I'm at. He's a man, so he has a little bit stronger ligaments. Okay. Here we are. Just a little bit more. Just a little bit more. And here just a little bit more, just until this moment, because if I push the cannula further and further, it will pull something of the first thread into this direction, and this is creating bumps at the entry point. So now I have here this V shape, but it's still quite superficial. So I lift the skin over the cannula. Okay. Now as everything is placed profound enough, I press here and I withdraw. Okay. In women, we always check that there's no hair inside. Sometimes they're quite long. That will be it. Okay?
Okay.
Do you want to do the next one, or do you want to do the next one? Do you want me to show one side and then you do the other side?
Yeah, I leave do one on here.
You want to do one now or later on the other
After we
side?
finish this.
Okay, so I finish one side. Can you give me another one? I'm fine with this. Because each one also has its tricks. Maybe you know them already, but with Tesla there are just one or two things to follow the steps and to follow the right instructions, and it will be just easier. So here, let's see where the opening is. It's painful?
Yeah.
Yeah? A little bit more of anesthesia. No, it's painful. Let's provide a little bit more of anesthesia. This is not sterilized.
Okay. You need it with cannula or with needle?
No, just with the needle, just at the opening point, a little bit. Maybe you can put a little patella there because I'm sterile, like this, at this part, and maybe at this one as well. Great.
Yeah.
Great. Thank you. And we'll do its action. Okay, let's see. Better? Okay. So we go quite deep, but not, of course, rupturing through the fascia. It's always a little bit tricky of the fibrotic tissue. Okay. Let's see, everything's fine. If there's a little bit of dimpling, I can also go a little bit back and correct it. Okay, now I felt that there's no resistance anymore. I go here. If the pinching is too difficult, I also can press down the cannula and I move forward like this. Some fibrotic bundles I can feel also for sure of the previous, yes. Go a little bit further, just until here. Now I'm here with the tip of the cannula. I press down and I remove. I fix here and I integrate it. I also like to do it with the palm of my hand like this. I have the same pressure at each point and not rather than doing it with the fingers. Okay. Now I check. I see all the lifting which I can do with this. Yeah? And now I have to fix it. So I just gained 2 centimeters here. This 2 centimeters which I pushed inside are the 2 centimeters which I lifted up the tissue. Now I reinsert. And as we said, the remaining one we can place a little bit along the jawline for more collagen stimulation in this area. So here it is also very important. If I do this movement and I want to go here, I will not enter here because it would make a crossover. Okay, so I push it a little bit to the other side. I lift one against another one. I go deep enough. Okay, now I'm here at the bone. So I switch directions and I move forward to here. Just until here, just until everything gets inside, integrated. I fix here and I move out. Another one, please.
Yeah.
So the one for the neck, I always do the last.
Yeah.
Now I do the first ones. So this is the first opening. Until the fascia as well. I do the light pressure, switching.
What is the length of this thread?
160 millimeters.
المكان
شايفها يعني
اللي انت بتستخدمه عادي.
تقريبا نفس الشيء. أصل أنا بص
هو تكنيك بس شوف ان ده نيو تكنيك.
So here I just saw that I was a little bit too superficial, so I made it myself a little bit harder to pass through. Here's the zygomatic bone, okay? So if I would go now from here further parallel, I would get to superficial. So this is the crucial zone where, especially in test lift, someone who's starting with this creating sometimes a little bit bulging and dimpling. So now I have to lift up quite a lot. Sometimes the pinching is here a little bit harder. So let's see, we always control by lifting this up. I see that there's no dimpling, everything's fine. And I move forward. Now I can go a little bit more parallel because I just crossed over here. And then in the jaw, especially in women who have like very thin skin, sometimes when we place this loop there, and it's right under the skin, they start to touch it all the time because they have the feeling that they have something there, and all of this touching creates a fibrosis, and probably a fibrosis which is causing a little bump there. So I like to place it a little bit deeper in the jaw. So I catch the tissue and I press one against the other one. So now the tip of the cannula is a little bit deeper. Okay. Fixation. And now I check. So we see how much this is doing actually with all of his jawline and even a little bit of the neck, you see? Now, strong fixation here. We always have to see a little bit dimpling here. Okay, then the mesh sometimes has to be a little bit stretched. Reinsertion, there's some millimeters. And as I said, in this one, I would choose to place a little bit more scaffolding suture here. So here, exactly the same thing. To not cross over, I move it to the side. Just until here, anchoring and getting out. You okay? So let's have the second one. We remember, we go there. So place it deep enough. It's very, very important here. Just until here. You see, I like to show this even sometimes to my patients when they're very curious of what we're doing. I tell them, like, you see how you get lifted? Okay, so this part, you see that it's very important, otherwise it would just, everything would sag down. So some of the steps of the technique are just for you to get the best out of it. A little bit more. the one for the neck done. Off a little bit here. Here's the 5th opening. So we go deep enough. I go until the bone, okay? And now I would like to ask him to put the chin on the neck as much as he can.
This is the neck.
Yes, perfect. And I see that all of this is a straight line, so it's very easy. Okay. And therefore it's not, here is a little bit too superficial. I remove. Like this, it's also very easy to pass through and not painful. All the skin is very sensitive in the neck. So if we are too superficial without this trick, this one will be very, very painful to place it. For the fixation, I also like to place myself in the same vector because I've seen many doctors like trying to fixate it like this or to do only like this. I have the feeling that I get the most out of it doing it like this, lifting this properly. You will feel how much force you can apply here. If you apply too much and you withdraw it, it's not a problem. You can reinsert it, only the tip of it, and reinsert it again, and you will get a feeling of how much the tissue and the thread is actually interacting with each other. So I like to do it with the tip of my finger. I have the most force out of it. If I do it like this, it's not the same. If I do it like this, it's also not the same. It's just a little bit my recommendation over the time that I found that this is giving me the most lifting effect. Okay, you see how nice it got lifted and it got stuck like this. Now I would choose the reinsertion again along the jawline. Just until here, engaging here, and moving out. Okay, half face down. Let's see the comparison. What do you think? We can also put him in the seated position to see.
This, yeah.
It's also on the touch, it's nice. You will feel that the skin is quite tight. Are you okay?
حط زي ما انت زي ما تريح نفسك.
Knees, the jawline.
Neck even.
Even the neck.
Can have a little bit like the face like this, yes, and a little bit lifted even more.
This area is much.
Nice, huh?
MashaAllah. Minus 10 years.